there, folks. It's Christine Scudder here, coming back to talk with you about child abuse and mandated reporting responsibilities. I want to acknowledge that this content can be difficult to think about for a variety of reasons. As I often will talk about in classes, a lot of these topics that we discuss in social work are not just things that happen, quote, out there. They're very much in here, right, with us. We may come to this work with our own histories of abuse and or neglect. We may be directly impacted by the ways in which children may be experiencing abuse and or neglect. We also may be, very directly involved in the ways in which the system that responds to child abuse and neglect, systems, both the child welfare system, law enforcement, and the courts, the ways in which those can and may touch our own lives, and in ways that are very painful and also have repeatedly racially disproportionate outcomes. There's a lot of pain all the way around in this topic, and I just don't want to jump in before really acknowledging that and just inviting, as always, for you to please take care of yourselves as you navigate this content in general. A subsequent module will talk a little more directly about self-care. But I just, if you need to pause or take a moment, come back to it, please do. And, just please notice what comes up for you as navigating this and other topics in this work. Sometimes that can be really helpful information in terms of what kind of supports might be helpful for you in navigating that. I want to acknowledge that many of us, I think I've said this before, come to this work with our own histories of different types of things that help us to really understand from a personal level and perspective, where people's pain points are, to really hold empathy and understanding for kind of the day-to-day impact, as well as the larger meso and macro level impacts of these topics that impact real people's lives all the time, including sometimes our own. So just want to start there and appreciate that part of our work. I like to start by talking about national data related to child abuse in the United States. Approximately 3 million reports of suspected child abuse and neglect are made annually in this country. That's about one report every 10 seconds. Our estimates are actually that the true incidence is about 3 times higher than what's actually reported. A lot of times abuse and neglect of all types for children, older and dependent adults, in cases of intimate partner violence, right? There's many bullying, right? There's so many incidents of that happen, in spaces where they're not reported to others, and people suffer in silence and struggle in silence. In 2012, an estimated 686,000 children were victims of maltreatment, and approximately 1,640 died from abuse or neglect. And some of you may have seen the Netflix documentary on the life and case of Gabriel Fernandez. It was a case in California where a child died. And part of what that documentary took a look at were the many different people who were involved, many mandated reporters, and also members of the child protection system, where there was a lot of mistakes made and things were missed. Reports were not always made and or followed up on. The reality is that, children do die from child abuse and neglect every day. You may know this, that every county in the state of California has what's called a death review team. We have them for child deaths due to abuse. We also have them for intimate partner violence related deaths. And I sat on the intimate partner violence one for a county that I worked in for a number of years. As a member of an employee of the child welfare system, CPS, to look at the overlap between child abuse and intimate partner violence, which is actually a much larger topic that I think is important for us to think about as well. And I'll reference a few small things about that along the way in this presentation. But each county has one of those, and we come together as child welfare professionals, as probation, parole, law enforcement, the courts, child abuse prevention programs, mental health department, the public health department, to look at every child death as a result of abuse or neglect in our own counties where that happens, and to look at what we missed. And so there's regularly these forums to talk about this. And of course, because of the clearance process it takes to get to that type of review. Often the review is happening several years after the actual death occurred. But I just want you to know that those are also ways that we can get involved on policy levels to making and facilitating change. And it's also just important, because I will also talk about the ways in which, this is a system of surveillance that also can be used disproportionately to surveil families and communities of color, and the ways in which that is extremely problematic. That there's also this other piece about, there is a very real risk to some children, and how do we hold both? And that's a very complex issue. It's a policy issue and it's a practice issue. So whether you're micro or macro focused, predominantly, I encourage us to think about how those come together. I also want to recognize that COVID-19, turned the world upside down in many different ways, including children's regular access to mandated reporters, right? Oftentimes school-age children, the people who often are mandated reporters are teachers and or maybe mental health providers. And with kids not being in school and not, having to do remote learning, there was a significant drop across the country in our data. And so 2018 is an important year. It's kind of the last full year that we have of stats prior to COVID. So just to share that context, so 482,265 reports of child abuse and neglect were made in California in 2018. 17% of those reports were substantiated. What that means is that these reports went to a child abuse hotline. They were investigated by a child welfare social worker, and 17% of them were found to be that there was evidence that abuse or neglect occurred. Okay. Now I want to clarify and differentiate between cases that are substantiated and children who are removed. Not all cases for which we find child abuse or neglect to have occurred. We don't always go to court on those cases. Some of my own prior work was as a child abuse investigator, and we would go out and, in some cases we would, if we found that abuse or neglect did occur, we would talk with parents and provide referrals and information, and then do something called an admonishment, which is sort of a legal term of finger wagging. Of course, I don't mean that. I would not actually wave a finger in a judgmental way, but certainly say to families very clearly, X, Y, or Z behavior or response to frustration or whatever it might be, is crossing the line. If this were to happen again, it could result in a removal. Here are some ways that we can support you to hopefully not get to that point, that kind of thing. And in some cases, if a case is substantiated, that's of course required to go to the next step, to go to court. In some cases, when families are referred to the court, they are allowed to keep their children in their care under juvenile court dependency jurisdiction, where the court stays involved and monitors their progress towards ameliorating the situations that brought them to the attention of the court. And in some cases, the court will decide to remove the children and place them ideally first with family members, someone they know. If it can't be family or family friend, in some cases, I've placed kids with their former teachers with whom they were very close and kept a relationship when there wasn't a family member who could take them to provide them with a temporary home. And we also refer to foster families as resource families, as more kind of current language. And if we can't do that, then of course we'd need to look at, foster homes, foster family agencies and things like that. And for the court to continue to monitor until families hopefully were able to make the changes needed to have children return to their care. And if unfortunately that could not happen, then children were freed for adoption. They may get involved in guardianship. And in cases where that was not possible, permanency is always the preferred option for the child welfare system. And in cases where that was not possible, then youth would remain in what's called long-term foster care. until such time as we could secure a more permanent option. So a case being substantiated, I share that, I know that was kind of a lot of information in a short period of time, but just to explain to you that just because a case was found to involve child abuse or neglect and, an investigator found evidence of that does not mean that children are always removed. And that's a myth, I think, that sometimes can come about, that if I make a CPS report on the hotline, that children will automatically be removed. That's not accurate. First of all, the hotline has to decide, that it rises to the level of an investigation. Many of those calls come through and they don't even go forward for an investigation. They're recorded in the database, but they don't go forward for reasons I'll talk more about later. And then those that do move forward, again, 17% in 2018 were substantiated in the state of California. So nearly 65% of verified cases of abuse or neglect were due to general neglect. And that's important to note for a number of reasons. The category of neglect and other categories of abuse, I'll go on to unpack in this discussion. But the large majority of these cases are general neglect. So let's come back to that, as opposed to abuse. Children 0 to 5 represent half of all substantiated cases of child abuse or neglect in California and comprise 47% of all cases in child welfare. This is a great data source, kidsdata.org, both for child abuse, also school-related outcomes, mental health outcomes. It's a wonderful resource for your papers and things you might want to learn more about in your practice. So hold on to that resource. I encourage you to do that. And one thing I want to say, kiddos 0 to 5 are much more vulnerable, right? They may be pre-verbal. And of course, that can be true for children of any age, may not always, have the ability to articulate to another person, to an adult, to understand, who can understand what they're saying for a variety of reasons. But little children, and infants and very young, small children may not always have the vocabulary and or even be verbal yet to, to rise to the attention of someone who can help them. So this is a particularly vulnerable population, and they do represent, the lion's share of cases that come to our attention. And that's really important to understand. So I want to talk a little bit about types of child maltreatment. There are different forms of neglect. And it's a general category. And as I mentioned, it's the largest reason for which cases are referred and substantiated in our state. And that's also true across the country, by the way. So there are different kinds and things to take into account. One is growth failure. Sometimes, with little ones, we might look at failure to thrive, which is is a medical, as well as a socio-political framework for discussing, a baby that is not growing and not developing as expected. There may be physical neglect. And one of the big things to keep in mind with neglect is the ways in which, and I invite you to kind of think about this as I go through the ways that this term is used and how people make meaning of neglect, and to kind of think for yourself about the ways in which the overlay of poverty and neglect and how those things can be conflated. And indeed, they are all the time. And I don't think it's any accident that 65% of cases are substantiated neglect. And this is a very complicated dynamic that we'll talk more about. But physical neglect often refers to, for example, families who have access to means. So, under the law, poverty is not child abuse, right? Those two things are not explicitly connected. Again, I think the implicit connection and the bias, class bias, that's a part of this system and many of our social service systems, frankly, that we're all really built and predicated on white middle class cisgender women. Those biases certainly play out in many different ways. But, so technically, right, poverty is not neglect. And to be clear, if families have access to food and resources or shelter and resources, and they are not providing the child with adequate food, with a safe living environment to stay in, that is considered a type of neglect. There's also medical neglect where, caregivers, parents do not ensure that their child has access to adequate medical care. This gets into, of course, a whole lot of other policy issues related to insurance and children that have been debated and solved in some degrees and others not. But looking at, access to primary care, to dental care, those kinds of things. And so a failure to take a child to the doctor or even to the emergency room if they're extremely ill would be considered a type of medical neglect. Not getting a child necessary treatment would be considered medical neglect. There is a complicated dynamics that can arise sometimes when, due to cultural views and or religious views, certain medical treatments go against the belief system of the family. And in some cases, the law will see that as neglect anyway, and in others it will not. And so that's one of many ethical dilemmas and also a policy dilemma that you might see in this work. Another type of neglect is inappropriate supervision. So there is not a minimum age by which children can be left home alone, for example, but there are ways in which young children who are left home alone without supervision, or maybe left in charge of very young children, maybe infants, and maybe it's a school-age child left alone with an infant for a prolonged period of time without access to call for help, maybe in charge of cooking, and they're not tall enough or don't know how to use the stove, or there's any number of ways in which supervision could be an issue. This gets tricky too, right? Parents who may not be able to afford childcare. Again, there is no legal age under which it's illegal for a child to be home alone. But typically how the system will look at this is, what is the age and the maturity of the child? What safeguards are put in place? Is there someone who's checking in with them regularly? Do they know how to use a phone and call for help? What's the level of what's required of them to take care of themselves and or maybe other siblings or children? And also, how long were they left home alone? Those are some of the things that are taken into account when we do an assessment of whether or not that's neglect. But there are not hard and fast, if it's an hour and they're 9, it's okay. And if it's 6 hours and they're 9, it's not okay. There's nothing like that. But we do take, kind of the totality into account when we look at that. Another way in which supervision can be a form of neglect are leaving children with someone, an adult, who the parent knows or reasonably should or could have known was not an appropriate person. For example, leaving children alone with a stranger who they don't know, leaving children alone with someone who maybe is a registered sex offender with a history of abusing children, or leaving children with someone who is under the influence of drugs or alcohol, or maybe the parent is home and they're using drugs or alcohol in the presence of the child while they're in the home. And so their ability to supervise the child is compromised. And then the child got hurt because of it, for example, right? Because the parent maybe was passed out on the couch and the child, went outside and got into traffic and, was in a dangerous situation, maybe would be an example, right? And so, that's another, if something like that were to happen, that would be considered a form of neglect. Educational neglect. Kindergarten is not compulsory in California, but first grade onward is. And so, unless a child is legally emancipated, parents are responsible for making sure that they get their children to school. Now, if, they have a child who has maybe a mental health condition and the parent is doing, what they can to try to make sure they get the help that they need and that they stay in school and, they remain in contact with the school, and yet the child still struggles to stay there. They may elope or run out. That's one thing, right? That's not neglect. But parents who are viewed as not taking an active role in ensuring that their child gets to school, that if they have to work, and can't be the one to respond, the system will look for, did you make, someone else can be in touch and be available if needed. Those are some examples, right? But And, teenagers maybe who skip school, if the parent is, doing what they can, that's not usually considered neglect, but cases where they're not bringing their child to school or they miss a tremendous amount of school without making arrangements to get work taken home, things like that, that can be considered neglect. Drug exposure. I want to be clear, in vivo drug exposure is not child abuse. The child has to be born and alive outside the womb to be the subject of a child abuse or neglect investigation. And that, as of this recording, I know that, rights to abortion are certainly being heavily questioned in this country again, with some serious legal repercussions that are imminent and may have been decided by the time you watch and listen to this recording in Texas, for example, to kind of think about the ways in which laws that may impact children in vivo can also call into question, rights to abortion-related rights. In any event, drug exposure, using drugs or alcohol in front of a child, drug paraphernalia being within paraphernalia and or drugs themselves, alcohol themselves being readily within reach of a child, sometimes parents using with their children or drinking alcohol with their children. Those are some examples of forms of neglect. In terms of abuse, I think these are areas that people maybe talk more about and may feel a little more familiar to us, or may not. But one type, of course, is physical abuse. That could include, hitting, striking, choking, pushing, shoving, punching, kicking, those kinds of things. It can also include use of an object. And we'll talk a little bit about physical punishment and how that works. I'll talk more about that. Of course, there is sexual abuse, and sexual abuse can, we'll get into more details about. It can include touch. It can also include penetration. It can also include exposure, inappropriate exposure to like pornography, and also sexual exploitation, where even if the parent doesn't do the touching, that they are actively a part of commercial sexual exploitation. Emotional abuse, threats, put downs, those kinds of things are examples of emotional abuse. Emotional abuse is very difficult to investigate by itself. It often is reported along with some other things. And we'll talk about some of the unique challenges of understanding and investigating emotional abuse. So I want to just invite you, if you are able to take in this content visually, to take a look at this image, which I will describe in a moment. But if you're able to take it in visually right now, I invite you to do that. Just notice what you see. And so part of why I invite us to think about this image, which I will now describe, and I want to recognize that we may not all be able to take this in visually, and that there's a lot of different ways when we say, what do you see? That can be both literal in terms of what do we take in visually through our eyes, and also kind of how do we make meaning of a situation, right? Whether we are able to take in the visual environment or not, how do we make meaning of what's happening? And so I want to point out here that some of us looking at this image may have seen this top right-hand side here might look like a shawl, right? And then we see maybe bangs of hair, and then a nose, and here an eye and another eye, and then this being maybe a mouth and a chin, right? And maybe this is like a kind of like a feathery coat of some type. And some people see this as an older woman. And some people might have looked at this and seen something very different, and seen instead what may appear to be a younger, possibly woman with a feather in their hair, with bangs, and that this here is kind of their face turning to the right, that this is their chin and their eye, and this is their ear, and that maybe this is a necklace, and maybe they're also wearing some kind of a feathery coat, right? So one of us, some of us may have seen a very young person, some of us may have seen an older person, some of us may not have taken in this environment visually, and some of us may have seen yet some other things in this picture. My point is that, our use of self as social workers is really critical throughout our work and assessment. And that includes, whether or not we recognize something as suspected child abuse or neglect, that we come to this work with our own lens, our own biases, our own thresholds, right? About what we think is harsh versus abusive, what we might see as setting limits versus overly punitive, what we might see as quote, good parenting, what we might see as what children deserve, right? And so a lot of these are, defined by our own life experiences, by our class, our positionality, our race, our class, our gender identity, our sexual orientation, our abilities, all of these things, our age, take into account how we make meaning of what we see. And that's important as we think about our role as mandated reporters, because when we make reports, it's important to understand that we're reporting what we experience, right? And so to the best of your ability, as a mandated reporter, I want you to think about the importance of what it means to make that phone call to the hotline, which is a hard call for a lot of people to make. Some of you experiencing this may have already made dozens of CPS reports. Some of you may have never done it. Some of you may be terrified of doing it. Some of you may feel like, it's a necessary evil. Some of you feel like it's really important and are really, proud of that part of your role as a mandated reporter. There's lots of feelings too that also impact how we make meaning of situations, what we might view as necessary to intervene, and where we might feel like, well, let's just keep an eye on it, or let's just keep checking in about it. I'm not so sure I need to make that call just yet. There's so much that goes into those assessments. And like many things, as I shared in the last lecture about law and ethics, please don't hold that by yourself. If you're wondering about something, please consult with a supervisor. But I also want to talk about, again, our cultural attitudes, beliefs, and practices all inform what we see as norms, right? And culturally specific practices, including norms about discipline, religious beliefs, spiritual practices, the meaning and manifestation of stress, including, whether that stress is shared with children or kept from children, what we consider to be, quote unquote, the best interest of the child. You will see that quote used frequently in thinking about child abuse and neglect. And I also just want to invite us to think about, of course, want to think about what's in a child's best interest, and just to think about the ways in which that can be incredibly loaded and incredibly biased based on the eye or the experience of the person making that assessment, right? Mandated reporting is an important balance between the individual rights of the parents and the rights of the child. And this is it's often fraught with ethical dilemmas. So our thoughts, actions, and behaviors are prioritized, justified, and supported by our perceptions, our beliefs, and our values. And I talked about those things in the last lecture about beliefs and values and how that plays into assessment. It's important to understand that the child welfare system, as I said before, is racially disproportionate in significant numbers, particularly an overrepresentation of Black children who are referred to the hotline, who once referred to the hotline. Those cases are much more likely to be referred for an investigation. If investigated, it is much more likely to be substantiated. Children are more likely to be removed, and if placed into care, stay in care and be reunited less frequently and or stay in care for much longer. This is also true. All of those same observations are true with Native American children throughout this country, also here in California. Nationally, we do see by region, we see differences in terms of Latinx families, and in many parts of the country, Latinx families are proportionately represented in the system, and in some areas overrepresented. And we definitely see that in pockets in California. And so I want to acknowledge that. As a whole, Asian families and white families are traditionally underrepresented in the child welfare system. And so, these are important things for us to take into account when we think about, who gets referred and what happens with that referral. I want to talk about how child abuse is defined in California. There are different code sections in California law, as I've shared before. Penal Code 11165, it defines in the law how all of these terms are understood. Neglect, severe neglect, so you'll see two different types. Physical abuse, sexual abuse, willful cruelty or unjustified punishment, which can include mental suffering, falls under emotional abuse. And we'll talk more about each of those. I want to talk about what child abuse is not. Child abuse is not, quote unquote, mutual affray between minors, meaning kids being in a fight. That's not child abuse. Now, I will say if we're talking about a parent where maybe there's a child, an older child who is very aggressive and has caused harm to maybe a much younger or smaller, maybe weaker sibling, for example, and the parent is not providing adequate supervision and that younger child gets hurt. That's an example where that could be an allegation of neglect on the part of the parent, but the fighting itself is not child abuse, if that makes sense. Reasonable and necessary force used by a peace officer in the confines of their employment. This section of the penal code is one of many where law enforcement officers receive carve-outs in the law for not being held criminally liable for their actions. We see and have seen many examples of where that police officers are not charged for excessive force up to and including killing people. And I just want to acknowledge this is another area where there is such a carve-out. Child abuse is not an amount of force that's reasonable and necessary for a person employed in public school to quell a disturbance. So, for example, a teacher trying to break up a fight in their best effort was to break up the fight, and maybe a child got hurt in the process of that. That is not considered child abuse. Or for the purposes of self-defense or to obtain possession of a weapon or other dangerous objects. So if in the middle of that fray and effort to try to preserve safety in a school employee could not be charged with child abuse. Spanking that is not considered cruel or unusual and does not expose the child to a risk of serious injury is not considered child abuse. In general, when we would investigate allegations of abuse or neglect and spanking was at issue, typically what we would say to parents is, if you believe in spanking and you want to and think it's important to spank your child to, as a form of discipline, open hand on a fleshy part of the body is an over the clothes is the I won't say preferred, but is the suggestion. When we are using direct skin on skin contact, we are more apt to cause injury. When using an object, a spatula, a switch, a wooden spoon, whatever it might be, whenever there's something in our hand, the person using the object doesn't feel the force of it, right? Because the force is transferred into that object. And so we don't get the feedback as the person doing the spanking. We don't know how hard it hits. If I spank someone too hard, I will feel it in my hand, right? And that will kind of be a signal to me, oh, whoa, I need to stop, right? And we kind of lose, and that's where things can get more dangerous, where in the process of doing the spanking or the hitting with an object, one doesn't necessarily realize as far as they're going. And so that's usually what a CPS worker would tell a parent who was spanking their child. And also, when we've left a mark that's gone too far as well. So just want to kind of clarify how that tends to show up in practice. So important reminders is that all children respond differently to the unique events in their lives. And so I'm going to share some kind of common signs, but I want to be really clear that number one, signs can overlap between different types of abuse, right? So a certain behavior we might see in children who may be being physically and or sexually and or emotionally abused, children who may be exposed to substance use at home, children who may witness intimate partner violence at home, right? So there may be a lot of overlaps, and also maybe children who maybe have a parent with a mental illness, right? There's all kinds of reasons, or a child who is experiencing their own mental health related concerns, might all kind of look, quote unquote, the same. And so I want to be clear that just because something is on the list doesn't mean, correlation does not equal causation. Also to say that, those lists are not meant to be exhaustive. They're meant as a guide, and follow-up is appropriate when you're not sure. So in terms of defining neglect in the law, it's defined under Penal Code 11165.2. This is defined as the failure to provide for a child's basic needs, including physical, educational, medical, and emotional needs. It can be the result of substance use or mental illness. So in other words, that's not, quote unquote, an excuse on the part of the parent. While we might be able to take that into account in terms of their case plan and how we might ask someone to get services and get help, a parent who may be dealing with a substance use addiction and or in the throes of, an episode of mental illness that makes it difficult for them to show up for their children. That doesn't kind of, quote unquote, excuse what is viewed as neglect. It's also important to understand that neglect can be acts of commission or omission. So an act of commission means that it's something that the parent had an active part in. They actively contributed to it happening. So I, as the parent, decided to leave the child home alone without adequate food for 2 days or more. Okay, that would be an act of commission. An act of omission could be where I failed to assess the situation about who I'm leaving my child with. So maybe my child was abused I left them with someone who I just met, and I just left them for an hour. And in that hour, that person sexually abused my child. While I am not the one who sexually abused them, and I am not being viewed under the law as someone who was involved in sexual abuse, I am culpable under the category of neglect for my omission, for my lack of care in looking at who my child was with, right? And who I left them alone with, if that makes sense, okay? I'm happy to answer questions if you have them. 2 types of neglect: general neglect, which is the failure to provide adequate food, clothing, shelter, medical care, or supervision, and no physical injury occurred. Severe neglect is injury that has or is likely to occur as a result of the neglect. So in that example of omission that I gave earlier, if I leave my child alone with someone and they were sexually abused during that period, and I reasonably could have known that person that I didn't have a good reason to think that person would be a safe person for my child, and they were harmed under that person's care, that would be considered severe neglect. Okay. I also want to recognize that children who are exposed to intimate partner violence, often referrals will come in under general neglect. I will say that many law enforcement jurisdictions throughout California, while it's not written into the law in this state that they must cross-report, many do as a part of their standard practice, cross-report cases where they've responded to domestic violence or intimate partner violence, and they know about children in the family, whether or not they were present at the time of the incident that the police went out to investigate. And in many cases, child welfare will substantiate cases of general neglect against the, quote, non-offending parent, and they view it as an act of omission, that parent allowed the abuse to happen in front of their children. This is an area of a lot of my work over many years, and it's something I feel very passionately about. I think this is a very complicated topic. While child exposure and adolescent exposure to intimate partner violence definitely has been shown to have numerous Negative outcomes for children in terms of mental health, problems in school, and otherwise. Not all children respond to this exposure in the same way. Not all experiences of intimate partner violence are the same. And so we do, in my belief, is that we need to assess, individual children about the impact of that behavior. This is work that I also do with the Judicial Council of California in working with dependency judges to train new judges who are coming in to hear cases and adjudicate cases of child abuse and neglect throughout the state, where we talk about this topic, and where I talk with judges about both how we try to train our social workers around these topics, and also how, my hope is that they can really assess on a child by child basis in their courtroom whether or not they feel that neglect is appropriate. It can have a chilling effect to charge an adult victim of intimate partner violence with child abuse or neglect, because they were also an adult victim. And so it's quite complex. I'm certainly not saying that it's ideal for children to be exposed to this in any way, shape, or form. But what we do know is that for children, when it is safe and appropriate to do so, sometimes, unfortunately, it is not safe because maybe the abuser is so dangerous that the children are at high risk of getting killed or being harmed in the midst of an incident. So sometimes it is not safe, unfortunately. But in cases where it is safe and appropriate to do so, children's outcomes tend to be better when they can stay with the person who we might refer to as the non-offending parent, meaning the parent who was not using the abuse in that situation. I could go on about that, and I do in another class. If you'd like to talk with me more about it, it's a topic that I'm very interested in and care a lot about. So the majority, as I said earlier in the presentation, over 60% of child abuse cases nationwide have to do with neglect. So in terms of signs of neglect, this list offers you, a list of signs to consider. Children who are constantly hungry or may have a dirty or unkempt appearance. Again, these two and several others on this list can also be things we might see with young people who are poor and who may not have access to a place to wash their clothes. They may be very well loved and not neglected in the least, but their family as a whole is struggling to access food. And so again, we don't want to take these on their own, and it's important to think about, and can we support families to have access to what they need? Sores or infection, lack of medical care, appropriate clothing. Again, this can also be a sign of poverty, so it's important to think about that. Consistently listless and tired, clingy or indiscriminate attachments, withdrawn, anxious, and or depressed. Children may present with developmental delays because of neglect. They may not receive adequate stimulation from the parent or caregiver, interacting with them. Maybe they're left alone for long periods of time, or they're not spoken to or held or, incorporated into the family. They may be, in a playpen in another room or in front of the TV, and maybe nobody really talks to them. That can be, some ways in which we might see some delays because of neglect, as opposed to maybe an organic reason that a child may have an intellectual disability, for example. Frequently absent from school, another example of neglect could be. I want to acknowledge, calls to abolish the police and to really, calls for abolition in general, and looking at the justice systems, quote unquote, the justice systems. There's also been a call to really abolish the child welfare system. And this movement came about a year ago. There have been calls for this for years. It was not started a year ago, but this particular movement, called the Upend movement, has taken a clear aim at the child welfare system in particular as a system of surveillance and a system that of punishment, instead of really kind of offering help to families. And clearly, I think, and some of you watching this are child welfare scholars and who are going into, at least for your 2-year workforce development contract, will do at least 2 years in public child welfare after doing an internship in that system. Some of you will remain in that employment beyond that, and some of you will do your 2 and go. It's a very complicated system. My work in it started as a domestic violence liaison, where my job was to help train all child welfare workers in our county to recognize intimate partner violence and how to respond in ways where, whenever possible, we could keep children with the non-offending parent and arrange for safety without removal and placing children in foster care. And so I was involved in policy change and training. And then I'd also go out with individual workers on any case where domestic violence was alleged, or throughout the life of the case, we became aware that it may be happening in the family, to try to model interventions. So it was both kind of a macro and a meso as well as a micro job. It's one of my favorite jobs. It was really challenging and really important. And I learned a lot about how hard it is to change that kind of a system from the inside. Unlike nonprofit settings and other spaces where maybe the board of directors and individual staff can decide, you know what, this isn't working for us anymore. We don't like this policy. Let's just change it. It's much easier to do that in a nonprofit setting than it is to do in a county child welfare setting, where a lot of the roles are actually defined in the law. How long you have to respond in an investigation, what you do, what is abuse, what is neglect. Not only how the job and the terms are defined are actually codified in law, not just policy, but law. Then on top of that, that you're actually, kind of an ancillary part of the criminal justice system, right, through the dependency courts in particular. And sometimes child abuse cases are also referred to criminal court. And so, there's a lot of complexity in that system. It is very, very challenging to change. It's not impossible, but it is challenging. And so some people are saying, we just need to scrap it and start over, that we really need to look at, do families have access to childcare? Do families, do people have a living wage? Does everyone have adequate access to medical care? Not only having insurance, but then, also, the ability to access what the insurance might cover. These are all things that, if we took more care in these areas, would we really need the child welfare system or child protective services to be quite so big? Do we really need an upend really specifically, and not exclusively, but does really take a very fine look at neglect per se, to say, how much of this is really poverty and how much of this is child abuse? So I just, you can check out their information. I have a link to it on B Course. You can look and read more about it. And, I think what's complicated about this, of course, is also kind of where I started this lecture, which is, we also have cases where children do die, and children are at risk, even if they're not dying or physically severely harmed, which also happens. But, children are in pain, and sometimes children need us to intervene, and sometimes their parents can't attend to their welfare, maybe because of addiction or mental illness or poverty, or maybe they never learned those skills and no one ever provided that kind of environment for them. So it's hard to teach and offer something you've never had. There's a lot of complex reasons for that. And then you add to that on top of it, a judicial system and systems of investigation like the child welfare system that are replete with racial bias and class bias. You add that together, and there's a lot of problems with how we do it now. That doesn't mean that there can't be workers who do a great job in that system. But it does mean that, there's a lot of room for improvement, to be sure. I think most people in the child welfare system who work in it will tell you that the system does a terrible job of raising children, and that we really don't want to be in the business of keeping kids in our care long term, if at all. And yet, what do we do, right, when a family, for whatever reason, can't keep their child safe? And that environment maybe is very dangerous for them. So I think this raises powerful questions. And part of why I'm going into it here in the role of mandated reporting is that I think that all of this is swirling in the minds of the mandated reporter, about, well, do I really want to make that phone call and initiate, kind of the the storm that is potentially a child welfare investigation. And that's complicated because we also have a legal mandate about what that means. And I'll get more into what is required of us as well. And so what I want to encourage you to do is to bring up these topics in your seminars, talk about them with your field instructors and with your supervisors, so that you're clear about what the law is, and that you're also clear about, what are some potential, maybe implicit or explicit biases, and what can you do about redressing those. And, I believe that as a mandated reporter, you have a lot of agency to decide how you construct that report, what you choose to say, how objective you can be about what your concerns are, and how you can check yourself, check your language, check your assumptions, and check check whether or not you may have made a mental leap between what you actually experienced and what your hunch is, and try to really stay to the facts. I think those are some very powerful ways that you can bring justice to a space that doesn't always feel or experienced as just to the people who are recipients of the services of that system. I want to talk about physical abuse as defined in the Penal Code 11165.3. Unlawful corporal punishment or injury can also be a type of physical abuse. I talked about, spanking a little bit earlier, but this is non-accidental injury ranging from bruises to severe trauma or death. Okay, so some children become physically harmed. They bump into something, they got a bruise on their head, they ran into the door, they ran into the coffee table, whatever. This is non-accidental, okay? Examples can include, but are not limited to, shaken baby. I worked with some very, very terrifying shaken baby cases where children are permanently disabled and unable to develop. Typically, some have had severe brain damage. Some were never able to walk again because of being shaken by a parent who was very frustrated and or under the influence or in the middle of a mental health crisis. And so those are, very severe cases of physical abuse. We also may see burning, hitting, punching, pushing, biting as some examples. And of course, I talked earlier about using objects as a part of that often can contribute to physical abuse, but are not required for physical abuse determination. Some signs of physical abuse can be bruises or black eyes. I do want to say it's important to think about skin tone of the child. So these colors are predicated on whiteness and, also a lighter skin tone. And so for some children, we may not be able to easily see bruises depending upon their skin tone and pigmentation. For children where they may be lighter skinned, you may be able to see red bruises at an initial stage. Blue or purple may be the next few days, yellowish green may be within the next week, and brown will be the second week. And so sometimes you may see children who have bruises at various stages. And what this might suggest to someone investigating it is that the abuse is ongoing, as opposed to maybe a single incident that you are investigating. That said, just because something may have been a single incident in the past week or two does not mean that it's the only time it's happened. So I don't want to, again, correlation does not equal causation, but I just share that to say those are some things that social workers may assess. Bite marks, burn injuries. You want to look at the shapes and replacement of those injuries might suggest what objects are used. Sometimes parents will say it was self-defense. But for example, if those were on the back, a child is usually leaving them or going away from them, and that is not consistent with a parent, if they are trying to say it was self-defense. Those are more investigative kinds of details. Those aren't things you need to, assess for per se, but I just share them as a brief notation. Behavioral problems, being wary or afraid of adults, aggressive or hostile. Fear of going home, may arrive early and leave late from school, for example. And sometimes kids may not say a word about what's going on with them, but they always come early. Maybe they really want to help the teacher. They want to help get the room ready, or just read a book, or just be in proximity to a caring adult. And they may consistently leave late because they're really kind of dreading going home. Their clothing may not match the weather or situation. Again, this could be related to not having a lot of or any, significant choices in the clothing that one wears, which could have to do with access. In some situations, it can also be an intentional way to try to hide injuries from the gaze of a mandated reporter. So children may arrive to school and it's very hot out and they're in, a jacket and long sleeves, or they're wearing a scarf maybe to cover something around their neck. So, those are things that you might wonder about, and, keep an eye for, but also to not make leaps in either direction. Sexual abuse falls under California Penal Code 11165.1. Sexual assault includes sex acts, molestation, intentional masturbation in the presence of a child. So assault can include something that may not involve touching the child directly, which is important. Sexual exploitation involves preparing, selling, or distributing pornographic materials involving children, performances with obscene sexual conduct, and child prostitution. And child prostitution also includes child sexual exploitation. So those are all forms of sexual abuse. Understanding sexual abuse, and I want to acknowledge that a lot of our data in public health and in sociology and social welfare continues to really hold a very clear gender binary, and there are limitations in that I want to acknowledge, that is also present in this list. About 12% of cases of sexual abuse, about 12% of cases of substantiated abuse or neglect involve sexual abuse. Of those, about 1 in 4 are girl identified, 1 in 7 are boy identified victims. A review of consensual sex between minors is important. There's a chart that I'll show on a subsequent slide, and you have access to in B courses. I think this is a really important slide, especially if you're working with middle and high school students, because it talks about, what sexual abuse in terms of consensual sexual intercourse or acts between minors, and questions about, is it statutory or not, in terms of rape, or and one of the important things with the chart, which I'll talk about, is it never is meant to override your clinical judgment, and we'll come back to that in a minute. 90% of children 12 or younger who are sexually abused know their abuser. There can be this stranger danger myth that it's, kind of the boogeyman out there or boogie person out there. Oftentimes it's someone that the family or child knows well. So that's important to know. And about 50% of sexually abused children show no physical evidence of abuse and have normal medical exams. So if we do a forensic exam, we may not see it or see evidence of it. And that can make the adjudication of sexual abuse difficult. At times, there are specialized CPS workers who are trained in forensic interviewing. And typically how those investigations are completed is that an initial investigation will not, the person who may initially go out on the call, if an allegation of sexual abuse is brought to bear and the CPS worker goes out, they will do very little investigating initially. If they have reason to believe it needs to continue forward in an investigation, there's a child interview center that all counties have, where it's a room with a two-way mirror, and on one side sits the public defender, the district attorney, the county counsel for the CPS system, the CPS worker assigned to the case, and they sit back there, and then the person who does the interview specializes in interviewing for sexual abuse, and in some cases of severe physical abuse as well, so that to try to mitigate concerns about trying it in court, and questions about leading the witness. And so they have an earpiece, and so that folks on the other side will ask questions so that they can conduct the interview, hopefully in ways where the child only has to tell their story one time, that they are not called to the stand if it goes to court, and to handle it once in a child-friendly environment, as child-friendly as something like this can be, with people who are specialists in that area, just to let you know that. And I've observed a number of those, and very appreciative of the people who do that work. It's very difficult to listen to those stories every day, and have that be your primary job. We're very special folks who have really specialized training. This is the reporting chart that I mentioned. This was created in medical spaces, so you will see it says patient, and that reflects medical language, but this also applies to us if we're in case management or therapy roles. So the age of the child on the left that you're working with, and the age of the partner or their sexual partner, or the person they may be involved with sexually on this side. So if you're working with a 12-year-old and they told you that they had sex with a 13-year-old, that's your clinical judgment, whether or not to report it. But if a 12-year-old tells you that they're having sex with a 14-year-old, that's a mandated report. Clinical judgment is just that. It doesn't mean, oh, I don't have to report it. It means you think about it. If at any time you ever suspect coercion of any kind, whether by size, intimidation, intelligence, experience, savviness, whatever, it's better to report it than not. And some people are very surprised by, for example, if your patient is 21 and their partner is 16, that it's not a mandated report. Some people are surprised by that. So again, I encourage you to use this as a resource, especially if you're working in schools, middle schools, high schools. If you're a therapist working with this age group of tweens and teens, this can be an especially helpful guide, and I encourage you to print it out and have access to it in your work. Signs of sexual abuse can include bruises and bleeding in the genital area, STDs, itching, discharge, recurrent UTIs, urinary tract infections, sudden social or emotional withdrawal, extreme compliance or defiance, excessive bathing, bedwetting, so regressing if they've been potty trained, regressing to bedwetting, feelings of guilt and worthlessness, sexualized behavior or knowledge that's beyond developmental expectations. And I know that we have some child development courses, and those of you working with children, will be taking those. But if you ever have questions about what's considered developmentally appropriate in terms of sexual behavior, it's important to, and if, sometimes if you don't have your own children, or you don't, work with children very much or haven't yet, I do encourage you to do more reading about that. Cutting and self-harm, abusing animals in fire setting. These can also be signs of other things. Like I mentioned before, you might especially see abuse of animals in fire setting among children who've been exposed to intimate partner violence. Again, as I said, this list is not exhaustive, and it's neither exhaustive nor prescriptive nor exclusive to sexual abuse or any type of abuse with these kind of checklists. Change of appetite and running away can be other signs. Emotional abuse has to do with attacks on a child's self-confidence and self-esteem. It's often accompanied by physical abuse or neglect, but not always. It can be hard to recognize emotional abuse for mandated reporters, and it can be very hard to substantiate for child welfare staff, which can be frustrating because, as many people talk about, that saying, like, sticks and stones may break my bones, but but words hurt forever and last forever. And so, emotional abuse is very powerful. It is it can cause a lot of harm. And sometimes it's less understood, and that can be frustrating for everyone, from the mandated reporter on through the system. It is important, I talked about in the last lecture about may versus shall, or things you have to do and things you can do in terms of exceptions to confidentiality. So a suspected mental suffering is not in and of itself a mandated report. So if you have a sense that it happened, it may be reported. But if emotional abuse is ever disclosed to you by a child, or you personally saw it or experienced it, you were present, it must be reported. So if you know it, it must be. But the suspected part is a may report, as opposed to suspected neglect, suspected physical abuse, suspected sexual abuse, physical abuse. Those are mandates. So just to differentiate that. Signs of emotional abuse can be extremely shy, or maybe, quote, difficult, maybe have a hard time responding to directives from adults, maybe seen as argumentative or very submissive, maybe excessively anxious to please, have nightmares, social difficulties, challenges in school, poor self-esteem, and learned helplessness, maybe some signs of emotional abuse, and also can be signs, of course, of other types of abuse as well. So I want to talk about mandated reporting and what exactly you need to do. So each state and the District of Columbia have their own mandated reporting laws. Child maltreatment is defined at the state level here in California, and it's investigated and addressed at the county level. So we have 58 counties in California. We operate largely in a similar manner, but there is a definite different flavor county to county. So when we think about our mandated reporting guidelines, we have the federal context of the Child Abuse Protection and Treatment Act. At the state level, CANRA, the Child Abuse and Neglect Reporting Act, which is outlined in the California Penal Code. And then we have individual county guidelines and practices. And this last part has more to do with how CPS workers locally do their job. That's not so much your purview as a mandated reporter, but I let you know that just to say that you might see some differences in responses based on the county that's responding to a mandated report. Mandated reporters are also defined in the law, including child care providers, educators, law enforcement, medical professionals, mental health professionals, commercial film and photographic print processors, which is kind of a relic of, before everyone had their own phone, people used to have to, get their film developed in large part in, at the drugstore or other places. And lots of times now people do that themselves. But these are also people who are mandated reporters, and all social workers. In your role are mandated reporters. It's interesting they don't list social work here. Sometimes we're kind of called under in this category, sometimes in mental health, sometimes as childcare or educators. This is another example where our professional standard of practice is, regardless of whether you identify yourself as being one of these providers, social workers are mandated reporters. When to report. If you have knowledge or observe a child in your professional capacity or within the scope of your employment, whom you know or reasonably suspect has been the victim of child abuse or neglect. So part of what this means is you are not a mandated reporter in your personal life if you observe or suspect child abuse, maybe within your neighbor, or maybe a family member, someone in your family, or a family friend, or someone, whatever, someone you see in your personal life. You're not a mandated reporter legally. Certainly there can be an ethical, sorry about that. There can be an ethical question as to whether or not you are a mandated reporter. Because you're always a social worker, like just in terms of your profession, right? You don't necessarily turn that off even though you're not at work. So certainly and there are protections for you because you're a mandated reporter if you make a report in your personal life. But to be clear, you're not mandated to do that. What is reasonable suspicion? When it's objective or reasonable for a person to entertain this suspicion based on facts that would cause a reasonable person in a like position, drawing when appropriate on their training and experience, to suspect child abuse. Okay, that might sound like a mouthful, and it kind of is. But what's important to understand is, as a social worker, you are assumed to have this kind of training and experience because you're a social worker. It is viewed as a standard part of your training, which is part of why we deliver it here. You have other means of receiving this information and training throughout your career in a variety of settings as a social worker. And so while you do not have to rely solely on a child saying, so-and-so abused me, that would be considered very literal. And sometimes that happens. But if you only report based on that, you're really not following your professional training, because we are trained to not only receive direct disclosures, but also to assess for, different ways of communicating concern, some of which are nonverbal. And so, if you were found to kind of ignore, not even consider other, maybe behavioral indications. For example, a child who may be, let's say, a 10-year-old child who's repeatedly masturbating in the classroom, and you're a school social worker, and they are appear to be dissociated while they're doing that, and they're doing that in the classroom, and they're non-responsive when people try to redirect them. Even though that child didn't tell you, I've been sexually abused, within our professional training and experience, that kind of behavior is considered very, very likely to be connected to some sort of sexual abuse or exposure. Okay. Could there be other reasons for that behavior? Yes. And it is also not your job as a mandated reporter to do the investigation piece. That is the job of a CPS worker who goes out and investigates if it's referred to an investigation. Okay, I just want to try to give an example of what I mean. So I want to talk about suspicion versus investigations. Again, as I was just saying, as a mandated reporter, your job is to determine whether you have reasonable suspicion of child abuse or neglect, not to investigate or make sure. Sometimes when you call the hotline, you may experience the person answering the phone to say, well, I need you to go back and ask X, Y, or Z questions. To be clear, that is not your job. So people, people can do whatever they want, but I just want you to understand under the law, it is not your job to investigate. And that does get into tricky territory for you when you're a mandated reporter, when you get overly involved in trying to investigate. Sometimes we can inadvertently damage a legal case that might need to come forward to protect that child in the long run based on, it may have been viewed that we were leading the child witness. And if you're not trained in doing that kind of investigation and it's not your job, that can sometimes get really tricky. And so I don't recommend that you do that. On the other hand, when you are looking at reasonable suspicion, please consider if you have reasonable suspicion or not. Is it a gut sense? And if it's a gut sense, please talk to your supervisor about it. A lot of times our guts tell us important things, but often in and of themselves may not be sufficient. Our guts can also be a lot about our biases or our own lived experience that may or may not be fully reflected in this current moment with this particular child. So please don't keep those things to yourself either, because we, want to listen to, signals or information you might be getting from yourself and how you're responding to how a child might be presenting. You don't want to ignore them, but, it's important to use them thoughtfully. Consulting with CPS by phone is not the same as making a mandated report. I will tell you that a lot of people hate making CPS reports, including your supervisors. And because I'm someone who used to work at CPS, a lot of my friends call me when they don't want to make a report and they're hoping they don't have to. Like, Christine, here's what's going on. Do I need to report this? And what I want to say is, if you are at the point where you are wondering if you need to report, almost to a situation, you've already met the threshold for reasonable suspicion. Okay, again, check in with the supervisor, check yourself, stay open and curious to, where you might be getting triggered by something. It might be more your stuff than what's going on. That's why you consult with other people. But if your supervisor tells you to consult with CPS, just consult, tell them what's going on and see if they think it's reportable. If you do that, and I know that's tricky because your supervisor might be telling you to do it, and I'm not telling you to disregard your supervisor. I am trying to explain to you what is legally considered meeting your mandate and what is not. If you were to call CPS and say, okay, here's a situation, and the person answering the phone says, yeah, no, that's not reportable. And then you go, okay, cool. And then you hang up the phone and that's all you do. You did not meet your mandate. Okay. As a mandated reporter, if you have reasonable suspicion, not assertion, you fill out the report, you call it in. If the worker says, you know what, this isn't child abuse, what you say is, I appreciate that. I would still like to proceed with making the report. Please take the information, give them the information, mail in the report. And if the system decides not to respond, that's 100% on the system. The reason why consulting is not the same, the person who answers the hotline is not a supervisor, usually. And it is their opinion that it is not reportable. Okay. You can look up in the law what's reportable and what's not. I talked to you about things like mutual affray between minors. For example, that's not reportable, but maybe your concern is that it's because of inadequate supervision by a parent who should have known that leaving a violent teenage brother alone with their tiny little infant brother, when they've said that they want to kill their little infant brother and then he punched that little kid, that is still, right? That's a neglect consultation, not consultation, a neglect report. Okay. But so consulting with the person who answers the phone is really their opinion. Okay. When you consult, and I will tell you that some counties have told their hotline workers, because people were abusing this and lots of people were trying to avoid making reports, but kind of like checking the box that they met their mandate, but without really making the report. And CPS was getting flooded with those. Those are also huge liability issues for the CPS system, because if, Joanna answers the phone and Joanna says, yeah, no, that's not reportable. You say, okay, fine, you hang up, you don't make a report. And then that child is harmed, right? Joanna has just placed the county in a huge liability space. And much more importantly, that child was harmed because someone didn't take more action. Okay. So when you make a report, it's logged into the system and the supervisors review what every hotline worker thinks. The hotline worker will say, I don't think we need to go out on this, or they'll say, I think we need to go out really quickly, or, whatever. And the supervisor has to approve that before that decision is made. When you consult, you override that option and you are not meeting your mandate. And so I just want to be really clear about that, because many supervisors advise their staff to do it, and their interns. So reporting suspected abuse to an employer, supervisor, school principal, or school counselor, or other person is not a substitute for reporting to a child protective agency. So if you were to say, well, I told my supervisor and they said it wasn't a problem, that they would do it, or they knew about it, that is not the same. You must report it to a child protective agency, period. And that's very important. Now, if you and your school principal or supervisor were both present and both got the same information, maybe your supervisor was shadowing you, maybe at your internship, and a child made a disclosure and you both know the same information, by law, you can decide between you which of the two of you will report it. And then that person will take the responsibility. But if you're the one, it's like if your supervisor said, okay, I'll be the one to report it, as the person who didn't, it behooves you to follow up with them and ask, did you make the report? Yes, I did. And then note that in your documentation. Spoke to supervisor on blah date, supervisor reports having made a CPS report. You put that in your notes and you've covered yourself. But it's important to do that follow-up piece and make sure. Sometimes people get busy and they forget, and you want to make sure if you're deciding between the two of you, there's a clear decision about who's making the report and that it was made. By law, a supervisor cannot impede your duties as a mandated reporter or subject you to sanction, meaning you can't get in trouble for making a report. I can tell you my wife is a fourth grade teacher, and she had a principal once who told her that she should not make a report to CPS because she didn't think it was really abuse. My wife knew that was not legal. She told her by law she had to make the report anyway. It turns out that the child had been being repeatedly sexually abused. The principal came back to her later and was tearful and was like, I never could have believed this could have happened. I never should have said that to you. And so, that's just one example. But people, sometimes that does happen and you can feel stuck in the middle. Part of why I'm giving you references to the law is so that you can know where to look back if you need to support your decisions to maybe go against what your supervisor is saying. If that happens to an internship, please make sure to involve your field consultant so that we can support you with that. Just briefly, again, it's not your job to do investigations, but like sometimes when you might hear particular information, it might be hard to know what to do with it, or if you have a suspicion and you want to understand more about what's happening. I want to share with you the difference between leading questions and open-ended questions. So just briefly asking, did your father do that to you? Like maybe you see an injury and you point at it. Did your father do that to you? Who hit your arm, right? Did he ever touch you on your pee-pee? Those are leading questions. Those are not the only types of leading questions, but they're leading because here you're inserting father or doing that, right? So maybe you're in the process of talking with the child about their father and they got into a fight and you see an injury on their arm and you say, did your father do that to you? You're making the leap between connecting father and whatever that is. That's the leading that you're doing. If you see an injury and you say, who hit your arm? Let's say you see something on an arm. Who hit your arm? You're now inserting that someone hit their arm, right? You're not trying to figure out how that happened, but you're saying who, like a person, and who hit your arm, okay? It leads them away from, for example, maybe it was an accident, or maybe it was not hitting, it was something else. Did he ever touch you on your pee-pee? This is very leading. It gets to an area, it gets to a behavior and a particular person. So these are just some examples of leading questions. On the other hand, open-ended questions, how did you get hurt? Okay, so it's not about ignoring that you see something, but how did you get hurt leaves it wide open, okay? Is anything making you upset? Can you tell me what happened? These might sound really obvious, But in the moment, you might be really worried. You might be very upset by what you're seeing. You might be with a child who is crying or who is clearly hurting, and you want to show validation that you care. That's very important. And when you ask open-ended questions, you let the words come from the child and you report what you have. When asked, the child said they were hurt by blah, blah, blah. They said, oh, I fell down the stairs. Okay. That doesn't mean if they tell you it was an accident, doesn't mean that you have to, override your sense that your suspicion that it was non-accidental. Okay. But you do report in your mandated report what was told to you. Reporting timelines. So you need to report when you become aware of child abuse, a suspicion of child abuse or neglect immediately or as soon as practically possible by phone. What does practically possible mean? Maybe you're in the middle of a session with a client and you have somebody right after that, but you have a break in 2 hours, you can do it by phone. Okay, that's within 2 hours. If you have the ability to maybe push back your next appointment, it's best to get that report in as soon as possible. Why? Sometimes children are in school and during business hours, though not all business hours, right? It's typically 8-ish to 3-ish. And so if you're able to call, if they had to respond before a child goes home from school, for example, you give the system more time to get out there and respond if needed. If they're not going to respond that quickly anyway, it doesn't hurt. But again, as immediately or as soon as practically possible by phone. Be prepared to give your contact information, the name of the child, the current location of the child, the nature and extent of the injury or concern in the case of neglect. Tip is to have a copy of the reporting form in front of you when making the report. We have a copy of that on B-Course. I encourage you to familiarize yourself with it. Even if you've made the reports before, I encourage you to have it in front of you, because when you have those answers ready, it will both be more efficient and it also helps you not forget things and not have to call them back because you don't have the information in front of you. A written report must be filed within 36 hours on the Department of Justice Form 8572. That's the mandated report form. You mail it to the county office of the person you spoke to on the phone. You should verify that address when you're on the phone with the appropriate Child Protective Services staff person. And this is within 36 clock hours, not business hours. Okay, so if this happens on a Friday, that means you're mailing it on a Saturday. Okay, and I'm all about you having boundaries and things like that. But it is important to understand that your legal mandate is to get this in the mail within 36 hours. A list of phone numbers by county is available for you on B-Course and also at childsworld.ca.gov under the Report Abuse tab so that you know who to call. Confidentiality for reporters. Mandated reporters, again, are required to give their names when making a report. If you're making a report in your personal life, you do not have to give your name. I will just tell you that typically CPS workers will give more credence to reports where they have a named party, but you certainly in your personal life have a right to not give your name. The reason I say they give better credence is sometimes people unfortunately use CPS to wage vengeance against neighbors they can't stand, ex-girlfriends or boyfriends or partners that they are angry with. In custody battles, family members will call and try to make abuse allegations against the other, and it can get really messy. So a lot of times the system will look at an anonymous source as like, but they'd always rather know than not. So better to report it if you have a concern. If you can give your name, please do, in your personal life. As a mandated reporter, as a social worker, you must give your name. Your name is kept confidential and may only be disclosed by CPS under the penal code in certain situations. Between child protective agencies, so maybe Alameda calls Contra Costa County because maybe the kid lives in Alameda, but the abuse actually happened when they were with someone else in Contra Costa, so maybe they have to share information. Just as an example, to the council representing the Child Protective Agency. So CPS has a county council that represents their interests in the court. To the district attorney and to the child's attorney in the case, they get to know who the mandated reporter is. To a licensing agency when abuse and out-of-home care is reasonably suspected by court order, and when you as the reporter waive confidentiality, if you do. In other cases, it is not shared. So it is not shared to the family upon whom the report is being made. That said, it's important to keep in mind that sometimes the context of the report, or maybe even the timing that it was made, parents may be able to deduce it was you, right? Like, I only told this to the social worker, and now the next thing I know, it's coming right back to me. Like, I know it was so-and-so, right? Even when they might say to you, I know it was you, know that the system is not legally allowed to share that, but they could deduce it. Now, in some cases, and in many cases as a mandated reporter, I will try to make the report with the parent together so it's very transparent, even put the CPS worker on speakerphone so the parent can hear the entire transaction. There are times, however, when that could actually put the child at risk. If I assess that the parent's presence or knowledge that I'm making the report while I'm making it, for some parents, they may abscond with the child, they may leave the area. That would make it hard for the social worker investigating it to find the child and make sure they're safe. In some cases, the child could get punished. The parent may go home and say, why did you tell Christine X, Y, or Z? It could also put the child at risk. They could get punished for telling outside the family. So you need to be really mindful. And this is one of those ethical dilemmas where, your commitment to social justice and to being very transparent, for example, might suggest to you that the best course of action is to report with the parent present, and tell them that it's being made and have them be a part of the whole thing. In other situations, that could put the child at risk. So please talk about those decisions with the supervisor before you make them. I raise it as an option and as a possibility that in some cases can work very well. In some cases involving, for example, domestic violence, where I might sit with the parent who was abused by their partner, but did not harm their own children. I might do it with them, letting them know why I need to call, to be more transparent, and that in those situations, sometimes that has been more therapeutic. And even though my role might not have been to be a therapist, to be more kind of client-centered, and some, not all situations can be very helpful. Mandated reporters have immunity from criminal or civil liability as long as you're reporting as required, even if the information was acquired outside your professional capacity or the scope of your employment. Meaning, if you're a mandated reporter and you report in your private life, you have immunity from criminal or civil liability, because we know that you're acting as a mandated reporter with that training and experience, unless the report is proven to be false and the person reporting knew it was false, or the report was made with reckless disregard for the truth. Okay, so basically it's important that reports aren't being used for retaliation or for any other reason than the reason of trying to ensure that a child is safe. Failure to make a report, it's important to understand, can result in a fine of $1,000, 6 months jail time, or both. If you fail to report and or impede or inhibit an investigation by, let's say, refusing to give information, a $5,000 fine and or not more than 1 year in jail. If, as a mandated reporter, you get contacted by a CPS worker and you're being asked questions, it's a really good idea to make sure that your supervisor's in the loop so that they can help guide you about what are the kinds of things you're allowed to share and what are the things that you cannot. Typically, remember, as I talked about in the legal and ethical side in general terms, limits of confidentiality include child abuse and neglect mandated reports. But remember, to share the minimum necessary. That's what is covered, where you can go, override your commitment to confidentiality with your client by sharing what's required to meet this, which is in this case, your name, the parties in the report, and what led you to suspect child abuse or neglect specifically, not the history, not how long you've been meeting with the client, not a hunch that you had about some other possibly related or tangential thing from 6 months ago, but why today you made this report. That's what you can talk about without client permission, okay? To go beyond that, you need a client to sign a release of information, okay? Talk with your supervisor about that, talk with your client about it. I often will be very transparent with clients to say, hey, your CPS worker is calling. They want to know what's going on. I will say, like, it's your decision if I talk to them or not. I will tell you that sometimes if they can't talk to me, they might assume that you're not participating in treatment. You have a right to set the terms of what I can talk about. So if you don't want me to talk about anything other than to say your attendance, you can set those terms, but I think it might, and you can say, like, I think it might help them to know that you've been in treatment for a long time and that, whatever. So you can talk with those things over with your client, talk about it with your supervisor. But again, going beyond saying why you suspect abuse or neglect and the parties in that report is going beyond the mandate of what you're allowed to share without a legally executed release of information from your client, unless you receive a subpoena from the court that says you must say more. And of course, if you ever get a subpoena, it's pretty rare that it happens, but it does happen. Make sure that you're talking with a supervisor before you say anything or respond in any way to a subpoena. Okay. So briefly, just want to let you know, I talked about this a little bit earlier. When calls come in through the hotline, the role of the hotline is to receive the reports. Each report is assessed individually to make an initial determination, and how and whether they decide to go out. The timelines vary by county. It's pretty common within the Bay Area that one assessment is to do an immediate investigation. That means that the social worker assigned has to get out there and start the investigation within 24 hours. In some counties, it may be as little as 12 hours where they have to get it started. Another timeline is a 10-day, meaning that the assigned social worker has 10 business days to get out there and start their investigation. And assess out means that the person who answered the phone and the supervisor felt that this did not rise to the level of an investigation. The information was nonetheless entered into the database, but it was not assigned to a social worker to go investigate. Some counties have what's called differential response, where even if they don't assign the case to be investigated, they can refer to a community agency to do a courtesy outreach to the family. Maybe the family's very housing insecure, or they may lack food resources, and it's not an evidence of child abuse, and it's not suggestive of child abuse. But you might send out like a community-based agency to do a completely voluntary offer for support that the family does not have to accept, and that CPS has nothing to do with. CPS might just say, hey, we'd like to refer this family to you to see if you could do an outreach, and then they close it on their end. The agency doesn't have to report back to CPS what happened. It's a separate but kind of related service that is not available in all counties, and even within counties, it's not available to all families. Often how counties deal with that is maybe in often frankly by zip codes, where there are high re-referrals from the community that aren't that don't rise to the level of child abuse, but where there's concerns, and that folks want to make sure that hopefully the families get the resources that they need, but it's really not a CPS matter. Another important recent development is the Family Urgent Response System, or FERS. It's a 24/7, 365 phone number, which is 1-833-939-3877. It is available statewide with local crisis response teams for foster youth and their caregivers. So these are youth in out-of-home care. This is one of many attempts to try to decouple police involvement and over surveillance of foster youth and families involved in the child welfare system. Whereas, like, let's say if a family were to have an argument with their teenager, they might handle it internally, they might go to a therapist, right? There might be any number of changes, or any number of responses. Less often would there be a police involvement for something like that, for just, I guess, kind of a simple argument or, that kind of thing, and not talking about violence. Whereas foster youth, when foster youth are involved, caregivers were often calling 911 and calling the police. Maybe they try to reach the CPS worker assigned and couldn't reach them, and then they just get really frustrated and call the cops, or foster youth would call the police on their caregivers. We may have heard the case of Micaiah Bryant, who had called the police for help at her foster home, and police killed her as a foster youth, several months ago, and a Black girl. And, we see this type of response, unfortunately, replete throughout the child welfare system across the country. And some of your colleagues from UC Berkeley actually presented about this, the bill that made this a law, that made this response system possible at the NASW Lobby Days 2 years ago. They did a really beautiful presentation before several thousand social work students from across the state to help inspire them all to lobby for this to become law, and it did. And so we want to offer that appreciation, and also to all of the current and former foster youth who do a lot of public policy work across the state to make things like this possible. These are trauma-informed interventions with local referrals to help support, when there's conflicts or challenges or, mental health related concerns that are expressed by either foster youth or their foster families or their resource families, that doesn't have to involve the police. So I have more information about that on B courses for your reference. So as I talked about at the beginning, personal and professional self-care is really important. So I wanted to start here and end here, right? That recognizing and responding to child abuse and neglect can be really challenging. I just invite you to continue to notice your reaction to learning about and deciding how and whether to respond to abuse, and seeking support from colleagues and or professionals when needed is a really important part of our practice. So I want to thank you for your attention. I know this was a long presentation. And I want to wish you all the best as you consider the challenging navigation of child abuse and neglect mandated reporting, that you hold that responsibility with a tremendous amount of reverence and care, and also an attention with an eye towards, how your own intersectional identities and experiences might impact what you see and how you might be apt to respond, how that compares to the law, how that compares to how your supervisor might be seeing it, and to make sure that you're consulting about all of those things. Okay, so thank you so much for your attention, and I'll see you next time.